Today, we're going to talk about something that has totally changed the game for doctors. It's called thoracic ultrasound. You know, this used to be a thing you could only find deep in a hospital's radiology department, but now it's a powerful, life-saving tool that's right there at the patient's bedside.
So what if a doctor could see inside your lungs, like right now, instantly, right at your bedside? No more waiting hours or even days for some big, complicated scan. Just think about that for a second. What would that change?
Well, here's the thing. With thoracic ultrasound, they can. It's not science fiction. This tech gives them an instant, radiation-free window right into the lungs. And that doesn't just change the diagnosis, it changes the entire game plan for treatment.
Okay, so here's what we've got on tap. We're going to see how this tool jumped from the lab to the bedside. Then, we'll peek under the hood and see how it actually works. You know, how it sees things. After that, we'll play detective and solve some thoracic mysteries. We'll also see how it guides doctors during tricky procedures. And finally, we'll look ahead at the incredible future of Tusk, as they call it.
So first up, a new bedside tool. We're talking about its journey from the radiology lab to the point of care.
You know, it's kind of hard to believe, but just 20 years ago, TUS was this really niche thing. A doctor would literally send a patient down to radiology just to get an X marked on their back, showing a safe spot to drain some fluid. That was it. Now, fast forward to today, and it's a completely different story. It's an absolutely essential tool that clinicians use themselves, right there on the ward, to make split-second decisions. And the impact? It's huge. We're talking better safety, way more precise diagnoses, and real-time patient care.
All right, section 2. How does ultrasound even see the lungs? Let's get into the basic toolbox and the key visual signs.
Okay, so the toolbox really comes down to 3 essential modes. First, you've got B mode. That stands for brightness. This is your classic 2D grayscale ultrasound image, the one you probably picture in your head. Then there's M mode, for motion. This one's super clever. It takes just a single line from that 2D image and tracks it over time. Why? Because it's crucial for seeing if the lung is moving properly. And last but not least, you've got Doppler. This is the one that adds color to the picture, showing where the blood is flowing. It's basically a real-time danger map that tells doctors exactly where not to put a needle.
And that M mode for motion brings us to probably the single most important thing a doctor looks for: lung sliding. So what is it? Well, imagine the lung is wrapped in 2 thin layers. In a healthy lung, those 2 layers glide smoothly back and forth against each other with every single breath. It looks like this gentle, shimmering movement on the screen. When a doctor sees that, they can breathe a sigh of relief. It means the lung is working. But if that sliding is gone, if it's just still, that is a massive, immediate red flag that something is seriously wrong.
Okay, on to part 3, solving thoracic mysteries. And really, it all starts with that lung sliding. This is where TUS really puts on its detective hat.
So, for a healthy lung, clinicians have this really cool visual cue. When they flip over to M mode on a lung that's sliding nicely, they see something called the seashore sign. Seriously. The top part of the image, which is the chest wall that doesn't move much, looks like smooth waves lapping the shore. And the bottom part, the lung itself moving and shimmering, it looks just like a grainy, sandy beach. It's this beautiful, unmistakable picture that tells them everything is okay.
But what about a collapsed lung, a pneumothorax? Well, the picture couldn't be more different. It's so stark. The beautiful seashore is just gone. Instead, all you see is a stack of straight, horizontal lines. They call it the barcode sign. Think about it, a barcode. It's a dead giveaway that there's absolutely no lung movement happening. The seashore has vanished, and in its place is this sterile barcode. And boom, the diagnosis is made right there, in seconds.
And this detective work goes even deeper. TUS is amazing at telling apart different, really serious conditions. Let's take something called lung consolidation. That's when a part of the lung that should be full of air gets filled with, well, other stuff. So if it's pneumonia, the ultrasound might show these irregular, blurry edges. If it's a pulmonary embolism, you might see a distinct wedge-shaped triangle right up against the edge of the lung. And a tumor? That often looks rounder with more defined edges. These aren't just subtle details. These are the crucial clues that help a doctor crack the case and get the right treatment started fast.
Here's another classic mystery for you. Is that little shadow a pocket of fluid, or is the lining of the lung just thickened? On a static image, that can be super tricky to tell apart. But ultrasound sees things in motion, and that's the key. Pleural thickening? It just sits there. It's static. It doesn't really change when the patient takes a deep breath. But fluid? Fluid moves. You can see it swirl and shift around. It's those little dynamic clues, the movement, that tells the doctor exactly what they're looking at.
Okay, section 4. Because TZEX isn't just about looking at things, it's about doing things. This is where it becomes a guide, making procedures way safer and more accurate.
Check this out, 50%. That's a huge number. Using ultrasound to guide a biopsy can slash the procedure time by up to half compared to doing it with a CT scanner. Just let that sink in. That means the patient spends less time on the table, you get a diagnosis faster, and that big, expensive CT machine is freed up for someone else who really needs it. It's a win-win-win.
So, you're probably wondering, how does that actually work? I mean, how on earth do you use sound waves to guide a tiny needle to a very specific spot deep inside someone's chest without hitting anything important?
Well, the process is actually incredibly elegant. Step 1, you locate the target. You use the ultrasound to find its exact location, how big it is, how deep it is. Step 2, you guide the needle. You are literally watching the needle on the screen in real time as you advance it, making sure you steer clear of any blood vessels. Step 3, you get the sample. You know you're in exactly the right spot. And then, and this is so important, step 4, you confirm. The second that needle is out, you do another quick scan to make sure everything looks good. It's this perfect, closed loop of safety and precision.
All right, our final section. We've seen how 2Us can diagnose problems and guide procedures. But what's next? The future is all about moving from just diagnosing to actually predicting.
And trust me, the future here is seriously cool. Researchers are now using TUTs to forecast how well a treatment is going to work. For example, they can predict if a procedure to glue the lung to the chest wall is going to be successful, which could mean a shorter hospital stay. They're even using it to predict whether a collapsed lung will manage to reinflate all by itself. And then you have these advanced tools like elastography, which is a fancy way of saying it measures how stiff or squishy tissue is, that are helping doctors tell if a suspicious spot is malignant, all without ever having to make a cut.
There's a quote that just nails this whole idea perfectly. The future is not just seeing the problem, but predicting the outcome. And that's exactly it. It's a huge shift in how medicine works. It's about using this real-time info to look into the future, to see what's coming, and to totally customize the treatment for each and every person.
So think about it. Thoracic ultrasound started as just a tool to draw a dot on someone's back. Now it's a predictive powerhouse that can fit in a doctor's pocket. It really makes you wonder, right? As these imaging tools keep getting smarter, smaller, and more powerful, what part of medicine, or even our everyday lives, are they going to transform next?